arena. Health experts have warned the president against holding this rally, fearing it could be a super spreader event. Joining us now, Dr. F. Perry Wilson, Associate Professor of Medicine at Yale University. And Dr. Wilson, when you hear that 6 campaign staffers in Tulsa have tested positive, what does that tell you about the current health risk at this rally?
Hi, Anna. Thanks. It's obviously quite concerning. First, I'd like to say it's great that these people were being tested. It's important. This reminds us how important testing is in our efforts to fight the coronavirus. It also reminds us that people who are asymptomatic, as I assume these staffers were, can still transmit the virus. And that is something that's really concerning when you have so many people together in a rally like this. And finally, what it suggests is that the prevalence of this disease, how common this disease is in the population, is not trivial. If you extrapolate the number of staffers to the people in that stadium, it's likely that there are anywhere between 100 and 1,000 of those 20,000 people in the stadium who may be carrying coronavirus and actively shedding virus right now. And that is a high-risk situation.
And as we look at these pictures and the crowds, just distant, how far they are to and how close they really are to the stage. And when you think of as many as 19,000 people possibly cheering and yelling, is the president at risk of contracting this virus, or is his distance from the crowd enough?
Well, the 6-foot distance that is recommended for social distancing is based on decent data, and other indoor places where the virus has been transmitted, restaurants and whatnot, do show that your highest risk when you're right close to someone who is actively shedding the virus. And so my perception is that the president will have a significant distance between him and the nearest crowd members. So the risk to him is probably relatively low, but the risk to those people in the crowd, the risk to his supporters, is certainly substantial.
Now, among the Trump campaign safety precautions for the Tulsa rally, hand sanitizer, temperature checks, masks provided to attendees, though actually wearing a mask is not required. And as we're just scanning the crowd, it's hard to see anybody wearing a mask. What is your assessment, Doctor? Is the Trump campaign being responsible?
Well, they did the bare minimum here. They handed out masks, but the fact that no one is wearing them is something that has really baffled me. How this seems to have become a political issue. The president himself apparently said that he thinks that mask wearing is a sign of disapproval of him personally. To a physician like me who's caring for patients with COVID-19, this is akin to saying that real Republicans don't wash their hands. This is simply a public health measure, and I wish the president would get on board with this simple intervention that has the potential to shut this pandemic down. If he could just encourage people to come together, wear masks, and stop the spread.
Let me ask you, though, further about the mask issue, because, inform us. What is the data showing as far as the effectiveness of wearing a mask or a face covering when it comes to COVID-19?
Well, we've learned a lot in the 6 months or so since coronavirus hit our shores. And I've been writing about coronavirus research for that entire period of time. And mask wearing has really emerged as the center point of the public health response. It is very effective. In fact, there was one study that suggested if 50% of the population wore masks when they were out in public, that the epidemic curve would trend down to 0. That the average infected person would infect less than one additional person, which is this key metric that shows that the epidemic is going to go away. So this is a low-cost intervention. It really does boggle my mind why this wouldn't be widely embraced.
We've been talking about how cases are going up in several states around the country. President Trump this week telling the Wall Street Journal, I personally think testing is overrated, even though I created the greatest testing machine in history. In many ways, it makes us look bad. What's your reaction to that?
Well, I think the president is trying to compare the U.S. to other countries. And he recognizes that we have more cases than any other country. And he wants to say that's just because we do more testing. Now, that is not entirely true. One thing we can look at outside of testing is the hospitalization rate. So just because you test more people, you pick up more cases, that shouldn't increase the hospitalization rate. It shouldn't increase the death rate. And yet we're already seeing hospitalization rates go up in some of those states where the case rates are going up. So we know that this is more than just we're testing, we're catching these people with minimal symptoms. This disease is spreading. And one of the major reasons it is spreading is because many Americans don't appreciate the risk that they have to themselves and to their loved ones when they're going out in public, if they're not social distancing, if they're not wearing masks.
I mean, in fact, when you talk about the hospitalization rate, it makes me think of what I learned today in a news alert from Washington State, where I have family where I went to school in Yakima County. They are out of hospital beds right now. They are in dire circumstances. So it is starting to catch up to certain areas, unfortunately. I just wonder, after tonight's rally, when will we know if this does turn into a super spreader event? When will that be reflected in the data?
It can honestly be very hard to tell. And so while I personally believe there will be significant transmission of coronavirus at this event, I do want to make clear that these are people coming from many states, it sounds like, not just Oklahoma. They're going to sort of spread out, and it can be difficult to tell if there's any one event that causes a spike. Although obviously we can look at that data and ask people whether they were at the rally or not. But we are not doing robust contact tracing, as you know, in this country. We're not figuring out where every infected person has been. And so we may not know for sure what exactly happened at this rally, but the biology is very clear. Putting this many people together, many of whom aren't wearing masks, many of whom are shouting and expelling particles, and many of whom may be asymptomatically infected, will spread the coronavirus.
Dr. F. Perry Wilson, important information. Thank you.
Thank you.
We are standing by in Tulsa, less than 2 hours away from the start of President Trump's rally. Will the public health risk be worth the possible political payoff? Sources telling CNN the president is already upset today that this triumphant return to the trail is being overshadowed. You're live in the CNN newsroom.